The PA oblique of the scapula or the shoulder is the Y view. And it's called the Y view because the acromion and the coracoid process form a Y shape with the body of the scapula. The normal position for the humeral head is directly superimposed over the junction of the Y. Typically, if there's a dislocation, it will not be right at the junction of the Y. So I have some pictures of those all on another slide that you'll be able to see. One of the things I want you to think about is what is the difference between a scapula Y view and a shoulder Y view. Because there's a slight difference. In the Bontrager book, it tells you exactly what the difference is. And in the Merrill's book, it tells you, it calls the shoulder one the scapular Y view, and the other one for the scapula is called a lateral scapula. So we'll get to that a little bit later, but there's a little bit of a difference, and I want you to see if you can think about what that might be before we get to the lateral scapula. So pay attention to where your CR goes and your collimation. Be sure to turn your collimator box to align the part a little bit better. You can do these AP, but of course then you're going to have OID and a little magnification, a little less detail. So PA view is better for those purposes. So here you can see PA position, you can see the Y, coracoid here, acromion here, and they come together and with the scapula to make the Y. Typically, but with the shoulder Y view, your humerus is going to be straight down. The transthoracic lateral view is typically for trauma patients who can't rotate or abduct their arm. So usually they're going to be standing, or you might be doing them laying down, and it might be cross table lateral with them laying down. So you have to be really careful, of course, with your trauma patients. Use the breathing technique. Look how beautiful this came out. Blurred the ribs out, and they can see pretty good detail on the head of the humerus and the glenoid fossa. These are really great pictures to list your anatomy and what you're seeing from the side. So we will be looking at that if you happen to get a transthoracic shoulder. Then the other view that you might see is the bicipital groove of the proximal humerus. It's a tangential projection, and it's a really easy view to do, but you got to know where you're aiming, and your collimation should be really small. So it's called lots of things. When I was in school, it was called the bicipital notch view, intertubercular groove, notch, sulcus. It's got a lot of different names, so your text might call them all different kinds of things, but it's basically a tangential view of the bicipital groove. And for the scapula projections, you're going to do an AP and a lateral. Use the same collimation as far as the shoulder. The lateral view, of course, you're going to probably do lengthwise image receptor so that you can include the whole scapula. This is what your position is going to look like. A lot of times you'll see patients with their hand on their forehead too, the back of their hand on their forehead, like a salute or maybe a drama queen, depending on your patient and their attitude. So forehead, back of the hand to the forehead of the affected side is typically what you'll see. And this is what your scapula will look like. Good anatomy here for you too. That'll help you in your image eval, your competencies. All right, here's the lateral scapula view. Look at this and compare it to the other one with for the shoulder and figure out what the differences are. I've never heard it called a lateral scapula view specifically, but it's a really nice view of the scapula away from the thorax, so you don't have any superimposition of the humerus or any of the ribs. And the central ray is going to be at the mid-medial border of the scapula. Compare that to the Y view, whereas you're centering on the Y view. All right, when you're looking at your image evaluation for your external rotation. These are the criteria that you're going to need to see when you're evaluating your image. Most of the rest of these slides are regarding image evaluation, so you know what to correct if it's not perfectly positioned. Okay, so external rotation, once again, you're going to see the greater tubercle. And the internal rotation, you're going to see the lesser tubercle down here. Let's see what else. The neutral position, you can see probably a little bit of the greater tubercle, but not as much as you do on the when you've externally rotated. Here's a Grashy view. I want you to be able to name all of the anatomy from this angle. And the transthoracic, we saw that view earlier. It's a really nice view. Here's the axial view. That's the one that's kind of tough, getting your angles in there right. And what you want to see, this is what you want to see on your scapula view. Here are those images. So here are some images of dislocation. And it says anterior and posterior dislocation have certain criteria. So dislocation anteriorly will be directly below the coracoid. You can see that here on this one. And dislocation posteriorly, you're going to see more under the acromion process. So very interesting views out there. And you can see the humerus is directly over the scapula on the scapular Y view, the PA oblique for the shoulder. Here's the bicipital groove. You can take a look at that. And your AP scapula, you can see the whole thing in here. The technique needs to be good in order to see the whole scapula behind the ribs. So pathology-wise, there's not a whole lot of, I mean, there are some unusual things like the winged scapulas we saw earlier that have to do with the muscles and nerves in the thorax. But a lot of times in hospitals and orthopedics, you're going to see a lot of fractures. So here's an example of a humeral head fracture. The AP shoulder projection is demonstrating the proximal fracture. Is this the anatomical neck or the surgical neck where that fracture is? What do you think? Here's a coracoid fracture. That's gotta hurt. You can see how it's the whole fracture there, how it's broken off. It's pretty interesting. And this one, I think we looked at this picture of my friend Joe when we were looking at the spine. You can see he has the thoracic spine fractures. He was in a motorcycle accident. But over here in this little red box, he has a pretty significant fracture of his scapula just below the glenoid fossa. And he had a pretty rough time. He was hit by a car whose driver wasn't paying attention to the possibility of a motorcycle being in the road. He sent me his x-rays so that I could share them with you. He volunteered to even let you guys practice on him, but I told him we can't actually x-ray humans in our lab. And this picture here is an example of some of the fractures that you might see on a scapula. They're pretty amazing, and sometimes they're difficult to see, so just keep that in mind. Anyway, that's about all I have for you guys. This is Joe and his wife. This was about a year after his accident, but he's doing really, really well now. That's all I have for this lesson, so I will see you guys in clinic.